alaikum wa rahmatullah. Today's topic is about dense invaginatus. It is a development in the enamel characterized by unfolding of the enamel into dentition, with a prevalence ranging from 0.04% to 10%. The complexity of dense invaginatus, particularly older type 3, poses significant challenges for diagnosing and treatment due to its intricate anatomical features and the risk of bacterial contamination. This study presents a series of cases that highlights the endodontic management of type 3 dense invaginatus, utilizing advanced imaging techniques such as cone beam computed tomography for improved diagnosis and treatment planning. So, as we know, the classification of dense invaginatus, according to Euler's classification, it categorizes into three types. Type 1, which is invagination restricted to the crown. Type 2, extend to the pulp chamber but remains within the root canal. And type 3, extends through the root, communicating with the periodontal ligament with further subdivisions like type 3A and type 3B. Based on the location of communication, type 3 dense invaginatus is rare, which has a prevalence of 3% to 12.5% and is associated with complex root canal system, increasing the risk of pulpal diseases. So the first case, it was an invagination with a C-shaped main canal. It was a 10-year-old boy with asymptomatic apical periodontitis in the mandibular right lateral incisor. Radiographics analyzed revealed a tooth within a tooth structure with a C-shaped main canal. Treatment involved conservative pulp therapy, epixification using bioceramic material, and successful healing over a 3-year follow-up. And first figure shows the preoperative and postoperative radiographs and CPCT images. For the second case, invagination with palatal sinus tract, a 14 years old boy presented with a swelling and pain in the right maxillary canine, diagnosis including a periapical abscess and dense indenti confirmed by CPCT. The treatment involved conservative access, removal of the infected pulp, and epixification, with successful outcomes noted at the follow-up. Goes for the second case, we have the clinical examination and the graphic images. For the third case, invagination with multiple separate parts, a 10-year-old girl with a pain in the right mandibular incisor, radiographic indicates type 3 dense invaginatus with multiple crescent-shaped canals. Treatment included a multi-canal approach with successful obturation and no symptom at the follow-up. You can see the figure 3, the clinical and the graphical images. And for the fourth case, no communication between invagination and the main canal. For a 35-year-old female with a swelling and pain in the previously restored maxillary molar, the invagination was entirely enclosed within the pulp canal, treated conservatively. Successful removal of the invaginated tissue and root canal filling were achieved with the patient remaining asymptomatic post-treatment. And for the first figure, it's the non-surgical treatment process image. You can see that the complexity of that type 3 dense invaginator necessitates a tailored approach to endodontic treatment. This case series study emphasized the importance of accurate diagnosis using CBCT to understand and interrogate the anatomy of the dense invaginatus. A proposed new classification system based on three-dimensional images is introduced, categorizing type 3 dense invaginatus into three categories based on the spatial relationship of the invagination to the main canal. And this classification aims to enhance the treatment planning and outcome. So, as we know, the endodontic management of type 3 dense invaginatus is challenging due to its complex anatomy. These cases presented demonstrate that conservative treatment can be effective, particularly when guided by advanced imaging techniques. And the proposed classification system may aid clinicians better way understanding and managing these complex cases, ultimately improving the patient's outcome. And thank you.